Swali yangu ni hivi. Hawa watu wanasema kwa mkingo, tunasema ni watu wote Chinyang'au. Na utosarao hawa hata hawa watakuwa kali na watamaliza sisi. Mimi zamani nilikuwa napeana hii sakula ya watu wa mkingo, na tumejua hawa watu wa mkingo watu wengine wanaona kama si watu. Bila tumetaka ni kukaa pamoja naye na kusema mambo mazuri na kuongea mambo mazuri na kuona hawa ni watu kama wewe, watu wa Mungu.
My name is Respo Wangombe. I'm an advocate of youth and adolescents, especially the adolescents living with HIV. Currently, the rates of HIV among the youths, it's very high, mainly because of stigma and ignorance and arrogance. Mostly you find that, especially the students at school, the campus students, you find that they don't have a platform where they can get engaged mostly, because we don't get these associations getting those AYPs, get? So unapata a student in campus hapatikani. Unapata a student in the university, si ati hana information, they have information. Some have shallow information, the rest have good information, because I believe wanasoma a unit on HIV. But wakikuja kwa the community, with as the community, how do we partake this issue of HIV? Tunasema ngam HIV, mtu akona HIV anakaa hivi, lakini tukienda kwa ground unapata watu wanasema aje, tukulana bila nini, condoms. Me always advocate for youths, we take condomization seriously.
There are a number of discriminatory laws, and some of them are within bigger laws that we have in this country. And one of the challenge, for example, we are currently facing is for HIV being transmitted through drug use practices, the people who inject drugs. In this country, we have an estimated 26,000 people who inject drugs. And we know that drug use is criminalized. And for them to come out, they need to get a space where there is a legal framework that can support them to be able to come to the facility, to be given clean needles of what we call harm reduction, and then from there to be treated for those who have HIV. The other laws that also stop some of the people that have high HIV burden, such as sex workers, men who have sex with men, also that criminalize those groups, and sometimes it also becomes very difficult for them to access services. Then we also have the other silent laws and policies that are in place, and one of them is the insurance one, and we were speaking about how over the years HIV has remained in the books of the insurance regulatory as one of the diseases that is either charge a higher premium when people are accessing a mortgage facility, or when they're accessing insurance for probably some of the health services. And what we are saying is that the government has set the way. It has shown the way of having an insurance scheme that does not discriminate or exclude people based on their disease. So we are asking also the private insurance to follow the same suit.